In this video made by Syzygy Health, you will learn to perform both intramuscular and subcutaneous injections. First, some tips for a successful and less painful injection. Applying ice to the area for 10 to 15 minutes prior to the injection can decrease pain. Let the alcohol dry completely before injecting. Try to keep the area you are injecting as relaxed as possible, especially for intramuscular injections. Insert and remove the needle quickly to decrease pain. Remove the needle at the same angle you inserted it. Apply light pressure with a tissue or cotton pad before removing the needle. And if desired, you may apply ice or warmth to the area after your injection. Have all of your injection supplies ready in front of you. That will include the medication you will be injecting, a syringe, preferably 1 milliliter, but 3 milliliter is also okay, needles to draw up, this will likely be 18 or 22 gauge, needles to inject. For intramuscular injections, this will be 22 or 25 gauge, and for subcutaneous, you will need 25 gauge needles, 2 alcohol prep pads, and a safe place to dispose of your needles and syringes after you are done. This is ideally a sharps container, but can be a thick, sealable container such as an empty sport drink bottle or laundry detergent jug. It can also be helpful to have a couple tissues with you and a Band-Aid to put on the area after you are finished, though many people choose to not use one after a subcutaneous injection. If you are nervous, you may want to have a cold drink with you, and you may want a friend or family member around just in case you need help or support. After washing your hands, take your medication out and make sure the expiration date has not passed. You also want to make sure the medication is not cloudy and you do not see anything floating in it. If this is your first time using this vial, you will need to remove the plastic cap from the top, which can then be discarded. Take your first alcohol pad and wipe the top of the vial, including the rubber area. Next, find your draw-up needle and your syringe and remove them from the packaging, taking care to not touch the hub where they will be connected. You can firmly twist the connection points together, but not too tight, as you will need to change your needle after drawing up the medication. To make drawing up easier, you should first pull down on the plunger of the syringe so that the top of the black seal inside of the barrel of the syringe lines up with the prescribed medication amount. Next, carefully remove the cap from your needle and place the needle down through the rubber area on the top of the vial. Press down on the plunger so the air in the syringe gets pushed into the vial. Then pick up everything and flip it upside down so the vial is on top. Making sure the needle tip is submerged in the medication, pull down on the plunger to allow the medication to flow into the syringe. If you have bubbles in your syringe that are larger than bubbles in champagne, you can flick the barrel of the syringe. This will cause the bubbles to rise, allowing you to push the air back into the vial by pressing up on the plunger again. Repeat this until you have your prescribed amount in the syringe without bubbles. You can now turn everything over again so the needle is pointing down and remove the needle from the vial. Carefully recap your needle, remove it from the syringe, and replace it with your injection needle. Next, you will need to decide where to do your injection. For intramuscular injections, you can choose the thigh, deltoid muscle, like where you get a flu shot, and the upper outer part of the buttocks, which may require another person depending on your flexibility. All of these places avoid major blood vessels and nerves. When inserting the needle, you will go through the skin and the subcutaneous tissue, or fat layer, and have the medication go into the muscle. Your needle should be inserted at a 90-degree angle to the skin and will go about 2/3 to 3/4 of the length of the needle. For subcutaneous injections, you can choose the thigh or lower abdomen, which can be done by yourself, the thickest part of your hip, which you may be able to do yourself depending on your flexibility, and the back part of your upper arm, which you will likely need a friend or family member to do for you. Again, you will go through the skin, but you will have the medication go into the subcutaneous tissue, not the muscle. To help with this, you can pinch the skin with your fingers about 1 inch or 2 apart, increasing the depth of the subcutaneous tissue. Your needle can be inserted either at a 45-degree angle or a 90-degree angle based on your preference, and will go about 2/3 or 3/4 of the length of the needle. Use your second alcohol pad to wipe off your chosen injection site by starting at the center where you want to inject and spiral outwards, creating an area a few inches across that is clean. Letting the alcohol dry will reduce the stinging sensation. Now uncap your needle. For For intramuscular injections, you will use the fingers of your non-dominant hand to stretch the skin away from the injection site. For subcutaneous injections, you will pinch your fingers inward but keep them 1 to 2 inches apart. With a dart-like motion, insert the needle into the skin. You do not need to pull back on the plunger. Use either your thumb or index finger to press down on the plunger to inject the medication. Once done, you can remove your non-dominant hand and remove the needle at the same angle it was inserted. You may see a drop of blood or medication at the injection site. This is normal and you can wipe it away with tissue or gauze. And if you would like, you can apply a Band-Aid. Good luck with your injection.